HIV, or the human immunodeficiency virus, is a serious virus that attacks the body's immune system. This virus specifically targets and destroys a type of white blood cell called CD4 cells, which are crucial for maintaining a healthy immune response. Without these cells, the body becomes vulnerable to a wide range of infections and diseases that it would normally be able to fight off. This system is our defense against infections. The immune system is like a well-coordinated army, with different types of cells and proteins working together to protect the body from harmful invaders, such as bacteria, viruses, and other pathogens. When HIV enters the body, it begins to replicate rapidly, overwhelming the immune system and making it difficult for the body to mount an effective defense. When HIV weakens the immune system, it becomes harder for the body to fight off illnesses. This can lead to a range of health problems, from minor infections to serious diseases like tuberculosis and certain types of cancer. Over time, if left untreated, HIV can progress to AIDS, or acquired immunodeficiency syndrome, which is the final and most severe stage of the infection. HIV is a global issue affecting millions of people worldwide. It does not discriminate and can affect anyone, regardless of their background or lifestyle. The impact of HIV is felt in every corner of the globe, with some regions, particularly sub-Saharan Africa, experiencing higher rates of infection. Efforts to combat HIV include education, prevention, and access to testing and treatment. HIV is spread through certain bodily fluids. These fluids include blood, which can be transmitted through sharing needles or syringes, and through transfusions of contaminated blood. It's also spread through unprotected sexual contact, where the virus can be present in semen and vaginal fluids, and breast milk. Mothers can pass the virus to their babies during childbirth or through breastfeeding. It's important to note that HIV cannot be spread through casual contact, such as hugging, shaking hands, or sharing food or drinks. It's important to remember that HIV can affect anyone, regardless of age, gender, or sexual orientation. Stigma and discrimination can prevent people from seeking the help they need, so it's crucial to foster an environment of understanding and support. Education and awareness are key to breaking down these barriers and ensuring that everyone has access to the resources they need. Living with HIV is a reality for many, but it doesn't have to mean the end of a healthy life. Advances in medical research have led to the development of antiretroviral therapy, ART, which can effectively manage the virus and prevent it from progressing to AIDS. With proper treatment, individuals with HIV can maintain a high quality of life and reduce the risk of transmitting the virus to others. With early diagnosis, treatment, and support, people with HIV can live long and fulfilling lives. Regular medical checkups, adherence to medication, and a healthy lifestyle are essential components of managing the condition. Support from family, friends, and healthcare providers can make a significant difference in the lives of those affected by HIV, helping them to thrive and achieve their goals. Knowing your HIV status is crucial for both personal health and public health. Early detection of HIV allows for timely access to treatment and care, significantly improving long-term health outcomes. Getting tested is the only way to know for sure if you have HIV. Early diagnosis is key. When you know your status, you can make informed decisions about your health and protect yourself and others. If you test positive, early treatment can help you stay healthy and prevent the virus from progressing to AIDS or acquired immunodeficiency syndrome. Remember, early detection and treatment are the best defenses against HIV. There are different types of HIV tests available, each detecting the virus at various stages of infection. Antibody tests are commonly used and can detect HIV antibodies in the blood, saliva, or urine. Antigen antibody tests detect both HIV antibodies and antigens, offering a wider window of detection. Nucleic acid tests, or NATs, are the most sensitive and detect the virus itself, providing the earliest detection. Your doctor or a testing center can help you determine the most appropriate test based on your individual circumstances. Remember, all HIV tests are confidential, ensuring your privacy and protecting your information. The time between HIV exposure and the appearance of symptoms can vary greatly. This period can be confusing and stressful for many individuals, as the virus begins to establish itself in the body. Understanding this timeline is crucial for early detection and management. This period is known as the window period. During this time, the virus is present in the body, but it may not be detectable by standard HIV tests. The window period can last from a few days to several weeks, depending on the individual and the type of test used. Some people may experience flu-like symptoms within 2 to 4 weeks of infection. These symptoms can include fever, sore throat, swollen lymph nodes, and fatigue. They are often mild and can easily be mistaken for a common cold or flu. These symptoms are often mistaken for other illnesses. Because they are so common and non-specific, many people do not realize they could be related to HIV. This can lead to delays in seeking medical advice and getting tested. However, it's important to note that not everyone develops noticeable symptoms during this early stage. Some individuals may feel perfectly healthy and show no signs of illness at all. This can create a false sense of security and delay testing. Some individuals may remain asymptomatic for several years. During this time, the virus continues to replicate and damage the immune system, even though the person feels fine. Regular testing is essential to detect HIV early and begin treatment. This is why testing is crucial, even without obvious signs of infection. Early detection through testing allows for timely intervention and better health outcomes. It also helps prevent the spread of the virus to others. Early HIV symptoms can be mild and easily dismissed. People might attribute them to stress, lack of sleep, or other minor health issues. It's important to be aware of any changes in your health and consider the possibility of HIV if you've had potential exposure. It's essential not to ignore these signs and seek testing if you suspect potential exposure. Early diagnosis and treatment can significantly improve quality of life and reduce the risk of transmitting the virus to others. Always consult a healthcare professional if you have any concerns. Early symptoms of HIV can mimic common illnesses, making them easy to overlook. Fever, sore throat, swollen lymph nodes, muscle aches, and fatigue are frequently reported. Other symptoms may include a rash, headache, nausea, vomiting, and diarrhea. These symptoms typically resolve within a few weeks, even without treatment. It's crucial to remember that experiencing these symptoms doesn't necessarily mean you have HIV. However, it's essential to consult a healthcare professional for proper diagnosis and testing. Section 6. HIV by the numbers, facts, and figures. HIV remains a significant global health concern. According to the World Health Organization, an estimated 38 million people were living with HIV at the end of 2023. Early detection and treatment have made a remarkable impact on HIV management. With effective antiretroviral therapy, people with HIV can live long and healthy lives. The earlier the diagnosis, the better the long-term prognosis. Statistics demonstrate the importance of HIV testing and early intervention. By knowing your status and accessing timely treatment, you can significantly improve your health outcomes. Section 7. Busting myths, don't be fooled. Many myths and misconceptions surround HIV testing, often preventing individuals from getting tested. These myths can create unnecessary fear and stigma, which can be harmful to public health. It's crucial to address these misconceptions head-on to ensure that everyone has access to accurate information and feels empowered to take control of their health. One common myth is that HIV tests are unreliable. This is false. Modern HIV tests are designed to be highly accurate and are continually improved through rigorous scientific research. The tests used today are the result of decades of advancements in medical technology. Modern HIV tests are highly accurate, especially when performed correctly and within the appropriate time frame. For example, rapid tests can provide results in as little as 20 minutes, and laboratory tests can detect HIV with a high degree of accuracy within a few weeks of exposure. It's important to follow up with healthcare providers to understand the best testing options for your situation. Another misconception is that only certain groups of people need to get tested. This belief is not only incorrect but also dangerous. HIV does not discriminate. It can affect anyone, regardless of their background. HIV can affect anyone, regardless of sexual orientation, gender identity, or lifestyle. Whether you are young or old, male or female, straight or LGBTQ+, everyone is at risk if they are exposed to the virus. Therefore, it is essential for everyone to consider getting tested. Everyone should consider getting tested for HIV at least once as part of routine healthcare. Regular testing is a proactive step in maintaining your health and well-being. Early detection can lead to better health outcomes and reduce the risk of transmitting the virus to others. Don't let fear or misinformation prevent you from getting tested. The process is straightforward, confidential, and can provide you with peace of mind. Knowing your status is the first step in taking control of your health. Knowledge is power, and knowing your status empowers you to make informed decisions about your health. By getting tested, you are not only protecting yourself but also contributing to the broader effort to end the HIV epidemic. Remember, the more we know, the better we can protect ourselves and our communities. Section 8. Taking control. Get tested, get informed. Getting tested for HIV is a simple and confidential process. Testing is available through various avenues, including healthcare providers, clinics, and community-based organizations. Many resources and support systems are available to help you navigate HIV testing and any potential results. Remember, you are not alone. Taking charge of your health starts with awareness and action. Get tested, get informed, and take control of your well-being. Section 9. Your health, your future. HIV is a manageable condition, especially with early diagnosis and treatment. Knowing your status is the first step towards protecting yourself and your loved ones. Don't delay, get tested today and prioritize your health. Your health and future are worth it.